Hello everyone, my name is Anastasia Pfister and my topic of discussion is causes of suicide among psychologists. It is the obligation of the psychologist to ensure their patients who pose a threat to themselves and their community are properly cared for and followed up on their health. Because of the great variety of patients they see, psychologists often put themselves and their patients in harm's way. Stress from listening to the sufferings of others may cause many psychologists to suffer from mental health concerns as well. Rates of depression and suicide have skyrocketed in recent years in this field of study. A considerable number of psychologists who are mentally ill are unable to accept treatment because of the backlash they face. One thing we should be able to understand is that psychologists are also prone to mental health issues. Just because they help people with their issues related to mental health doesn't mean that they are not at risk like other frontline workers. Lack of knowledge is the number one cause that leads people to stigmatizing psychologists that struggle with mental health conditions, and most of the time, the result of the negative stigma results in suicide. There are various factors that result to suicide in general. Physical illness is one of them. If someone is suffering from cancer and they are experiencing a lot of physical pain, they might want to commit suicide. The second one is social isolation, which has been a cause of depression and stress amongst many people, especially with the current pandemic. Mental disorders such as anxiety and depression are huge risk factors of suicidal ideation. Mental disorders can also cause unemployment and unstable relationships with others. These factors can make it even more challenging for people to seek help. Family conflicts is another example. If one is going through a divorce, they might find themselves in a state of helplessness and isolation and struggle to find a solution to feel happy again. A current situation of hopelessness is being experienced a lot lately due to the COVID-19 pandemic for our frontline workers and the general public. Psychologists fear seeking help because of the stigmatization at their workplaces. The fear of losing their jobs and what society would think pushes them to suicidal thoughts. Many believe that a psychologist who also struggles with mental health issues is not capable to take care of others. But just like anyone else, psychologists too should be able to seek help without the fear of judgment and loss of clientele. Also, depression and stress from daily life issues and possibly mental health conditions can lead to hopelessness and loneliness. All the anxiety and desire to seek for help pushes them to look for an easy way out. Psychologists should take some time off to concentrate on easing their stress to avoid getting depressed over the issues they hear on a daily basis. This can help them balance their work life and personal life. They can do this by disconnecting from social media once in a while to avoid sad news, taking walks to clear their minds, writing their issues down, and finding a schedule that works best for them. When psychologists seek help, the weight of having suicidal thoughts are lifted off their shoulders because they are able to speak to someone and ease their depression and stress. When they are empowered, they are able to put up a fight against being stigmatized by society for trying to seek help for their personal struggles. As stated by National Center for Biotechnology Information, large studies have proved how psychologists are at high risk for developing mental health disorders such as depression, anxiety, drug misuse, and suicide ideation. Pope and Tabchnik conducted a national survey of 800 psychologists and discovered that the majority of those who took part had been in treatment, with 61% reporting that they had at least one episode of severe depression throughout their careers. 29% of those polled admitted to having had suicidal thoughts, and with roughly 4% admitting to having attempted suicide. When a psychologist passes away from suicide, the clients that were once seeing him or her might begin to doubt whether they should continue seeking help or not. This sometimes can lead to hopelessness, which results in higher suicide rates. Since psychologists are an essential aspect of society, it can affect not only family members, but society in general. There are multiple ways we can offer a solution to the problem, such as stopping stigmatization in society and conducting campaigns against stereotyping at workplaces. Workplace corporations can provide workers with essential tools, such as confidential one-on-one therapy sessions with other psychiatric corporations, group discussions, and programs tailored to their personal needs. By doing so, frontline workers can gain confidence to seek help without fear of losing their jobs. Lastly, by ensuring that work schedules are flexible enough to avoid straining and burnout, we can minimize the risk of suicide among psychologists.